You're welcome. Thank you so much. Yeah. Your audio is off. Please switch on your audio. You're on mute.
Hi, am I audible now?
Yes, you're audible now. Thank you.
And is the voice is clear?
Yeah.
Or should I arrange earphones and also?
No, we can hear you. We can hear you.
Okay, that's wonderful. First of all, I'd like to really extend my regards to all of you. Hi, who's this person greeting me? Thank you anyway. So kindly accept my regards, and it's really wonderful. Today is Republic Day because usually we are damn busy with our patients, and Rohit ji has really requested me so many times. So I have apologies for me. Maybe give it to me. So my daughter has got earphones for me. So in case it is required, I can use it now, right? But if I'm audible, then I'm comfortable.
Yes,
So
yes,
should I
you're
go like
audible.
this, or you want me to put audio phones? Is it fine, guys?
Yes.
Okay. Thank you so much. So I would like really, first of all, like to pay thanks to every person in Happiness Valley because this is, I think, a group of people who are really doing so hard these days because this is unprecedented situation, Corona and pandemic, which is still continued, and we really don't know which direction it's gonna take in next few months' time. So Happiness Valley is something which is doing really good, and this is kind of effort which is really required these days because I since I told Jyoti ji it will be better if people ask question and I would be able to answer as a psychiatrist. But I'll just take 5 minutes time to just make you guys understand what is the current scenario these days. Corona is causing a lot of mental stress and mental problems. So maybe 5 years ago there was a time when cardiology, cardiac departments, and people who have cardiac illnesses were the population which was prone to all these kind of problems and stress and all. But let me tell you, in the last 1.5 years, what has happened? We are seeing at least 5 to 6 new cases of anxiety or obsessive compulsive disorder, OCD, or depression because of corona. So usually when we write history of a patient, it's very mandatory to write down is there any precipitating factor or not. So all of you will be surprised nowadays. One of the most common precipitating factor is corona, lockdown, loss of interaction with family members and friends, and this is taking a toll upon mental health of all the population of all the ages. But there was a study which was done on 23rd of January, I think 2021, it was published. It was done by Indian Psychological Psychiatry and with some collaboration with PGI Chandigarh and NIMHANS Bangalore. So they have identified 4 particular populations which is very prone to corona-induced stress problems and mental disorders. So I would really try to mention all those things and why it is so damn important. First population and foremost is people who have pre-existing mental illnesses. That is population 1, okay, which is most prone for getting any sort of problem due to this pandemic coronavirus infection and all. Second population is children. So children, right from childhood, adolescence, teenage, and all, they are all involved. Anyone who is not adult is taken as child in that particular study. And they have given 5 strata in which the age division was done. Third was elderly, old age people. And you will be surprised, fourth was healthcare workers, especially doctors, nurses, and me and people like you who are sitting next to me. So all of us are very prone to. Let me tell you. So even if we are sitting at home, don't be so happy that you are in Happiness Valley and you're gonna have everything very happy in life, right? Because we are the one who spread happiness to everyone. But at the same time, we are prone to get the negativity, right? Because we have certain amount of positivity what we can spread out. So something which is very important to make you all understand that we need to make sure that we will be helping each and every our patient or maybe each and every of our subjects or clients, but at the same time it is a duty to take care of ourselves also. Because in corona, you will not believe burnt out phenomenology is so damn common in health caregivers and professionals, and especially in mental health workers. So let me tell you, all of you, that be careful. You are on the on the snipers range now, and any day you can have any problem. So be very careful. So how we'll be able to come out of it? That's very important. Though Roliji and all you guys must be knowing far more than me, because I know more about pharmacological aspects. I would be able to tell you medicines and all. But let me tell you a few things which are very important really. First is we need to really keep on charting our behavior and our behavioral symptoms in the form of that whether I'm doing everything as I was doing maybe 1 month ago or 2 months ago or 3 months ago, whether I'm having the same temperament with my staff, whether I'm behaving in the same manner what I used to do maybe 1 year ago with the children and all. Because so many times once we start asking these questions, we'll be able to really understand whether we are doing these things or not. So what is most important is to really ask these questions to yourself and to analyze our own phenomenology, our own subject, and we should take ourselves as a subject also. Because one of my colleagues, who was also a roaring psychiatrist, he called a few days ago and told me, "Boss, I'm having depression." Don't joke, yaar. Come on, it's fine. If you want anything, any sort of help, tell me. But no, boss, I'm really depressed and I'm trying to take myself out of from it. It's not possible. Is it possible to come to your place? So many of why so, yeah, no one is visiting. This is, and that was a time when it was lockdown. So I said it's already lockdown and we should, at least as doctors, we should respect corona behavior and all, and we should not, I think, meet. Well, no, boss, it's seriously required. I want to meet. And believe me, I'm not kidding. When he came, he's my 2 years junior to me. When he came to my place, I was really surprised. He was in tears and he told me I'm depressed. So I asked, "Do you have any family history of depression?" He said no. Then I asked, "Are you seeing your patients these days?" Well, no, I stopped seeing patients for last 1 month time. Then what are you doing these days? Well, I'm nothing. My wife is asking me to go and show to Dr. Tiwari or any of your colleagues, or maybe if you don't want to tell your colleagues, maybe you show it to someone else. When he started telling me all these stories, I was able to understand how this all happened. We all have certain amount of propensity to get depressed or sad. So one thing which is very important is, which I really want to clear before going ahead, there's a difference between sadness and depression as a syndrome. Okay. Sadness is something which is a very common emotional kind of a behavior which can happen to anyone, anytime, and it has certain reasons. But depression is something which is pervasive. Pervasiveness is very important in depression. It has to be round the clock, it has to be present, irrespective of the fact whether you are in a good situation or bad situation, whether you're in a company which you like or not, whether you really are in a situation which you used to enjoy or not. So pervasiveness is very important, which we should always keep in mind. So my doctor friend told me, "Boss, it is pervasive." He told me all the diagnostic formulations. Then I asked him whether you felt these kind of problems any time in your life. He said yes. When I was about here in my MD exams, during that time also I had certain amount of problem, and I was thinking that maybe I'm having certain amount of dysphoria, which is a lower level of depression. So what I understood from this episode, that all of us have propensity to get these kind of mental illnesses. At the same time, what is important, he didn't ask those questions which I've told you right now. So be very sure that it is a duty to take care of ourselves first, and then only we'll be in a position to take care of others. So we need to make ourselves strong. So through Happiness Valley, I really want to tell all of you that it's amazing. And though because I'm coming for the first time, so I'm not well impressed, what kind of a classes and group happenings take place over here. But let me tell you, what is important is what I'm able to understand, that you guys are doing very nice work, because I've gone through certain WhatsApp and all. So that's lovely, and people writing so damn wonderful. I don't have really words to express. So Roli ji, and I think one more ma'am is there. I really want to congratulate you for those wonderful, lines which I've read for you guys. So kindly accept first of all, I'm missing the name, Mrs.
Anu.
Yeah, Mrs. Anu, yeah.
Yeah.
So I would really congratulate her on through this platform.
Thank you so
So
much.
I think it's better if you have all of you are health professionals, or can you introduce about the group so that I would be able to understand what to really speak about?
Actually, see, Happiness Valley is for those who want to be a part of Happiness Valley. There are many coaches
Okay.
on my group. There are many healers on my group.
That's wonderful.
And there are many professionals and homemakers too on my group. So
okay, fine. So
yeah,
it's a
we are a
mixed
team of
population.
more than 150 people. And
That's wonderful.
yeah. So every Wednesday, I introduce a new healing modality so that my audiences get a fair idea how to go
Okay.
about. So let me introduce.
So this time it's gonna be more professional rather than modalities. I'll tell you medicine.
Right.
Okay.
Thank you.
So let's go ahead. So now I'm able to understand, because I was pretty confused on the back of my mind.
Yes.
Whether I'm talking to all health professionals or
Yeah.
homemakers. Now I'm able to understand some mixed population.
Oh, yes.
So let me tell you what is better is that kindly you raise your queries, and whatever you want to ask. I'm a neuropsychiatrist, and I've done MD in neuropsychiatry from King George's Medical College.
Yeah.
And I don't want to give rest all the introduction which is already given by Roli ji. So I'm a medical professional person, so you can ask any questions and anything which you want to really ask.
Thank you so much, Dr. Nilesh. And let me share, I'm a life coach and a psychological counselor. So there are two types of illnesses. One is neurosis and one is psychosis. The milder form is neurosis and the severe form is psychosis. Neurosis can be healed through counseling. For neurosis, you can contact me. But if it is a severe form, you have to contact Dr. Nilesh because it involves medication also. So when counseling along with medication happens, the healing becomes much faster. So guys, I'm sure you must be ready with your questions. Dr. Nilesh is here. Please ask your questions to him. Dr. Nilesh, the session is all yours. Thank you so much.
Sure, ma'am. Sure, no problem. Thank you so much.
Very good evening, sir. I'm Rajeshri. I'm a mother of a 19-year-old child.
Okay.
The thing is, he is very good. Like, what I mean is, when he speaks, nobody
understands. Boy or girl, male or female child? Tell me that first.
He's a boy, 19-year-old boy.
Because psychology is different. Male is having different psychology, female is having different. Yeah. Okay, go ahead.
So the thing is, his behavior at home is very different. For the outsiders, it's very different. I have noticed as a child, he has issues. But when we take him to a psychologist or anyone, he is very well aware that we are going to a psychologist or psychiatrist, so he doesn't let out anything. He knows he has to be very good. And anybody talks to him, they will say he has no issues. But as a mother, I know he is short-tempered, or he has a foul language and all that. How do I address this issue?
That's I think it is something which is happening very commonly in each and every second house of Delhi or maybe metros. So my first question is, when did you realize that he's having some sort of problem?
So it was like we lived in UK. I've realized when I used to ask him to drink milk, he used to take 1 hour. When his father used to tell him, he used to finish in 15-20 minutes. I told my husband, see, each child might be responding differently to a parent. So he listens to you. So it would be easy for you as a parent and a child to understand things. So do take care. But being a normal South Indian husband, he said, oh, everything you're pushing on me. But with time, I have realized, even now, if I say something, he's totally against. If his father says anything, he might be against, but because of the fear or something, he does it. It's even in education, he's not that great. His behavior is also not good. But something he follows due to his father's, and his father is not very strict with either of it. He says, chal raha hai, chala rahe hain, chalega. So 50-50%. He's not going to the grassroots level of his problem. And when I tried all my level best, he is not ready to come with me or take any help. He says, no, I don't want to come. You do whatever I don't care. That is his standard answer.
Well, let me tell you, first of all, what is most important is to make your child realize that he requires certain amount of or certain sort of help. Okay. What is happening is when you take your child to a psychiatrist or psychologist, he's a smart guy. He understands
Yes.
that
Yes.
he'll be observed. Okay. So rather than opening up, he is doing mock drill. He is befooling the child, the psychologist also, as well as parents also. Right? So, ma'am, I'll tell you, it is very important to understand the situation. And what is most important is that you and your husband should become one unit, first of all. And let me tell you, that is the biggest problem which is happening in today's society. Mother is standing on a different platform and father is standing on a different platform. Okay. So nowadays kids are very smart. They'll be managing one parent in a different way and other parent in a different way. And they know how with whom how to behave how. Okay. So what is important is first of all, you and your husband should become one unit. Okay. Once you guys will become one unit, you would be able to understand what are the need of your child. How you ask your child to sit down and you both of you then ask do you think that you require a certain amount of change in your behavior? Do you think that will be able to help you in certain ways so that you'll be able to perform better? So first of all, try to notice what are the places where your child is lacking and he is able to understand. Okay. So what is important is to get his consent first, to make him understand first that you require help. Unless until you will not take his consent or you make him understand, you won't be able to take even a single step in his life.
That is the grassroots
I hope I'm
problem,
able
sir.
to make you understand. So
Yeah,
what is
I
important is
understand.
become one unit. Both parents become one unit. Number one point. Second point, sit down. Both of you talk to him in a very friendly fashion. Ask him that, yeah, buddy, I want to really help you out. Nowadays, you're not performing as you used to do maybe 2 years ago, 3 years ago. I hope everything is going fine. If something we can do for you, just tell us. So it should be, very much informal conversation and ask to pick up some points because each and every case is very different. You have to work in psychiatry. That is the problem. It is not 2 plus 2, 4. So many times it's 2 plus 2, 22. So you need to understand what is going on in some other person's brain. So what idea I'm giving you, I think you would be able to do that. It's a kind of formulation. So
I
both
do
parents should become
understand,
one.
but
Number two, take consent and make him understand first of all that he requires it.
so the main
Because
issue
so
over
many
here
times,
is
a patient comes to me and very, very high profile patient comes to us. Extremely high profile. Means I'll not take name or designation, maybe a deputy
yes.
chief minister's daughter or maybe such kind of people. And they come to us, they take an appointment. I told them, no, he's not ready. He'll not listen to me. I'll not talk anything else. And in front of his father, I'll talk, hi, guy, do you booze? How's your life? How many girlfriends do you have? Then I ask, okay, I'll see you next time. Then they'll ask, doctor, साहब आपने तो कुछ पूछा ही नहीं. आप तो उसकी गर्लफ्रेंड और उसके वो सब बात करते रहे. मैंने तो अपॉइंटमेंट लिया था आपसे, मैं इतनी मुश्किल से निकल के आया हूँ और आपने कुछ भी नहीं पूछा उससे. मैंने कहा बाद में पूछूंगा. Let him become my friend first. So many times it requires to start first session after 10th session. So that is the smartness of a therapist. So you are in UK.
No, we have moved to India 10 years back.
Okay,
But
because I do have a lot of good friends in UK. I would have suggested you. Anyway, are you in Delhi?
No, in Hyderabad. Actually, even in UK, I told my husband we'll take him to the therapist because he was not.
Ma'am,
that
don't
good
take
at
him to a
writing.
therapist. Don't do that. Again, you're committing the same mistake.
No,
That's what I'm telling you. Listen to me. No, let me explain you once again.
Right.
Don't take him to a therapist. First of all, make him convinced that he requires a therapist.
Okay.
Unless until you are not able to reach on step 1, don't try to climb step 10. It's not possible.
Okay.
And the biggest problem is so many times in India, therapists, they are ready to take a session because they're going to get certain amount of money.
Yes.
But try to understand that is ruining your child's mental behavior also. Because we do see a lot of patients who are very in anguish and who are very irritable with the previous therapist. That's why they stop going to therapist. So kindly don't do that. I hope I'm clear to you, ma'am.
The grassroots level problem is me and my husband are not on the same page. I say something.
That's what I've told you.
that's it, that won't happen, sir, because I have seen over the years, I have been informing him for at least last 5-6 years, please take him. He is coming
Archie,
with me.
please, I would suggest you can
I'm
have
doing
a
this for
personal
last 20,
session.
25 years.
Okay.
So I'm very clear to you. That's why I answered this question that first of all, you and your husband should come on the same page, right? Become one unit, then only you will be able to do it. And that's the problem. So I think you both of you and your husband should sit down and first of all, resolve conflicts between you. Then only you can proceed to your child, right?
Okay. As a mother, I
Best
would like to
wishes.
help him, but it's not happening. Anyway, thank you. I'll do that. I'll try my
My
very
best wishes to you.
Yeah.
Please
Thank
don't
you.
worry. Best wishes.
Yeah. Thank you. Thank you.
Divya, you wanted to ask something? Unmute, please. Yeah, thank you.
Dr. Tiwari, good evening. This is Divya
Hi,
here.
Divya. Good evening.
Acha, about 14-15 years back, I was diagnosed with lupus. And within 3-4 years, it went into lupus nephritis. So I'm on
So it was
immunosuppressant.
systemic lupus erythematosus. What?
Systemic.
Was it systemic lupus erythematosus? SLE?
SLE.
Yeah, that is systemic lupus erythematosus. Fine.
Systemic. Yeah. So I'm on immunosuppressants right now. They're about 500 mg. And my steroid has been worn out completely. So my question is, I saw your website yesterday and I had one query that the medicines that they provide in psychiatry, do they clash with the steroids or immunosuppressants, or how does it go? Or do you have safe medicines which can work with immunosuppressants and steroids?
Well, let me tell you, very interesting question, Divya. And I think this is a query which is always there in any person's mind. Though you have SLE, so you are very much cautious about it. Let me tell you, in psychiatry, medicines are absolutely safe. First of all, I'm not advocating this fact because I'm a psychiatrist. I'm telling you this fact because we are very sure about our medicines. These are targeted missiles, okay? So suppose we want to enhance your 5-hydroxytryptamine serotonergic level in your brain, then we do have medicines which are absolutely selective for serotonergic transmission in brain. They are not going to affect norepinephrine, dopamine, or any other neurochemical. Okay? So first things, Divya, it is absolutely safe. Second point, I'm able to understand so many times a patient who is taking these immunosuppressants and steroids. He is prone to get two things. One is psychosis, other one is depressive symptoms also. So we do treat a lot of patients who are having drug-induced psychosis or depression. Fine. So these medicines are absolutely helpful. We start in full-fledged dosages in the beginning. And once our patient responds, maybe after 3 weeks to 6 weeks times, then we go on a maintenance phase, which is there for the next 3-4 months time. And then we also decrease medicines, right? And during Corona, we had a lot of patients because you might be aware during Corona, we were giving methylprednisolone. Okay? You must be aware because steroid was the cornerstone of the treatment of Corona, especially in second wave.
Second wave, yeah.
So we were getting a lot of patients who are going in psychosis. Right. And I'll tell you in our ICU also, a lot of patients, they start suspecting our own staff because that was the time when, everyone was in PPE kit. They have never seen this kind of a situation where you are not able to see a face. You are watching faces. They are also, clad in mask and all, PPE kits and all. So a lot of patients, they start giving complaints. No, the doc, they want to kill me. They are hatching a conspiracy against me. Yes, I'll tell you, one of my colleagues, mother was admitted and he called up, "Yaar, Tiwari, tumhare yahan kya ho raha hai?" From Australia. He's a psychiatrist. He told me, "Boss, kya ho raha? My mom is saying that nurse wants to kill her." I'm like, "Yaar, you are a psychiatrist. I understand. She's in paranoia. She's in psychosis." So he was in Australia. Those guys were not using a lot of steroids, so he understood. So I'll suggest you, if you have any sort of symptoms and if you require any sort of psychiatric help, do take medicines. They are absolutely safe. Dosage are important. That's what is I'll like to tell you. So make sure that it should be on lower dosage, but otherwise it's absolutely safe. You can take.
Acha, Dr. Tiwari, I have one more question. I have tried to get into therapy before, and it's
What
like
kind of therapy?
I'd taken a psychologist appointment, psychologist.
Okay.
I think I have a barrier while talking about myself to stranger or something, because जब मैं जा रही थी, I had a full conscious understanding and I was open, and मैं अपने consent से गई थी कि चलो, I have to try this because I have to get better. लेकिन वहां जाके पता नहीं क्या हुआ, he kept on asking, and I understood that I'm talking to him through a filter.
Okay.
So do you get cases like this, or do you have any suggestion how we can bring down our guard system and this filter?
Well, let me tell you, a therapist is a key, okay, and a
Uh-huh.
patient is a lock. So
Uh-huh.
it is the duty of a therapist to be the right key. Each and every person is having certain amount of guarding, and we need to be very smart to how to remove those guards, because psychological guarding is very important. And I don't believe you are such kind of a person. Because in first conversation, I can understand. Believe me, you are not. So I'll blame your therapist rather. I hope therapist is not listening to me. But I'll literally blame your therapist, because you are an open girl, you would be able to tell everything within 10-20 minutes time. Right?
Nice. क्योंकि ना, we are not having a session, that is why आपको लग रहा है. So I was thinking, if I explain this situation to the therapist before, or to the psychologist or whomever I'm speaking to, so do you think they'll be able to address it in a different manner and take care of
Well,
it?
I'm not able to understand what is your problem. So either if you are comfortable, tell me your problem, then I will be able to tell you a straight solution.
Acha. Rolly ji wants to say something.
Yeah, please.
We are running short of time, Dr. Nilesh, and everybody wants to ask you so much, but since we are running short of time, I will have to take just one more question. One more question. I will request you to come once again on Happiness Valley so that people can get their answers and we are able to solve
आप
them.
Happiness Valley थोड़ी late start करिए ना, so that we'll be able to finish up our OPDs. Because 7:30 is very hectic, and usually we have our OPDs full of patients. So थोड़ा एक late session रखिए, ma'am.
I understand. That is, I'm so grateful to you for taking out time and sharing your knowledge with us, and I'm sure it is very helpful for us to understand
because,
that it is important to have that the parents should be on one stand. The parents, there should be no difference between parents' opinions about their children. So parents should work as a team, and it is very important for the patient to understand that he needs therapy, because until and unless he's open to taking therapy, nobody will be able to help.
Right.
So it is very, very
That's
important
exactly right.
yes, because no matter how much I give you a pencil, if you are not ready to take, it will not come with you. Only if you are willing to take something, then only I can give you, no matter how I am good at it. No matter how good prescription Dr. Nilesh prescribes, but if you don't eat the medicine, how will it help? So the willingness part has to be there. So thank you so much. And if anyone has any question, we can take one more question. It's almost time. One quick question, if you have. Please unmute and ask fast.
Hello, Dr. Tiwari.
Just 1 second. I'm getting a call from ICU. Just 1 second.
Yeah, please take the call.
Dr. Vivek, 2 मिनट Zoom पे हूँ, बाद में बात कर लूँ? कोई emergency तो नहीं? हाँ जी ma'am, sorry. Yeah, please go ahead.
Thank you so much for the wonderful session today. Thank you, Rolly ji, for bringing Dr. Tiwari. I'm in Canada, Calgary, and working as a professor in University of Calgary. और मेरी स्पेशलाइजेशन नहीं है, मैंने कार्डियक इलेक्ट्रोफिजियोलॉजी में अपनी डिग्री की है, और मेरे पास बहुत सारे स्टूडेंट्स हैं, मैं इंस्ट्रक्टर हूँ जो उनको पढ़ाती हूँ, तो मेरे पास स्टूडेंट्स हैं जो अपनी प्रॉब्लम्स लेके मेरे पास आते हैं. यूनिवर्सिटी बहुत सारी रिसोर्सेज प्रोवाइड करती है, साइकोलॉजिस्ट, साइकेट्रिस्ट, एवरी रिसोर्स इज हियर, बट समहाउ वो एक कनेक्शन होता है कि जिसकी वजह से वो सारा कुछ मेरे को बताते हैं कि ये प्रॉब्लम चल रही है, कुछ है। तो इसी की वजह से मैंने ये फील्ड चूज किया, मैं एक वेलनेस कोच बनी, लाइफ कोच बनी, पर फिर भी कहीं ना मुझे समझ नहीं आता कि इन सिचुएशंस को कैसे हैंडल करना है। मैं उनको रेफर जरूर कर देती हूँ, पर वो साफ कहते हैं कि हम उनके साथ कंफर्टेबल नहीं है। बहुत सारे बच्चे अब जैसे कोविड में अपनी ये जैसे आर्म्स को कट करते हैं, ड्रग्स लेते हैं, बहुत कॉमन हो चुका है, बहुत, एटलीस्ट 10 में से 1-2 बच्चे तो करते ही हैं।
Out of 10, at least 3 to 4.
जी। तो
Never
ये
less
तो
than 1/3.
मैं देख रही हूँ जो केसेस ना, तो समझ में नहीं आता कि एज अ इंस्ट्रक्टर, जो कि मैं आपकी तरह नहीं हूँ, पर अगर कोई मेरे पास आए, मैं अपनी तरफ से पूरी कोशिश करती हूँ, पर मेरे लिए कोई टिप्स और कुछ है जो मैं उनको एडवाइस कर सकूं?
देखिए, पहली टिप्स तो ये है कि सत श्री अकाल, और कैलगरी में मैं भी रहा हूँ, और वहाँ पे मेरी वाइफ का बहुत फेमस पंजाबी रेस्टोरेंट है,
जी
and it
जी
is one of the most famous one. Okay, so I'm little nostalgic about Calgary. Ma'am, पहली बात तो you have taken a big task in your hand. Okay, cardiophysiology is something which is done by hand, and you need a robotic brain, which is trained, which requires training of not more than 6 months time. Then you would be able to do it.
yes
You can sing a song and you can do cardiophysiology, right? But once you are talking to someone and you are helping someone, you are providing certain amount of psychological help,
yes
then you are supposed to be on your toes and you are using a full brain. Okay. And every day you're going to have new lessons, new chapters, new equations, and you're supposed to solve them on your own. So, ma'am, I can help you in various ways. First of all, Roliji is there, so I would like to really tell we are going to start a platform on which we'll be able to sort out these kind of problems. So very shortly we'll be coming up with an app also. So our hospital is developing an app on the basis of which we will be able to provide services on different platforms. Like Roliji said in the beginning, there is neurosis, there is psychosis. Okay. So first thing which is more important as per the International Classification of Disorder, Volume 10, neurosis is something in which insight is present. Okay. And psychosis is something in which insight is absent. So this is a broad classification which I just want to tell you on day one so that you would be able to remember this. And if someone comes to you and you find that his insight is absent, then don't try to help with this guy, because you won't be able to help him. So better is to refer such kind of patients to a psychiatrist, right? And if you find someone who's having insight present, like he is knowing that his problem is this, then you intervene and try to solve that problem. So lesson 1 for you is try to differentiate between the two and don't take patients who have psychosis because you won't be able to help them.
exactly.
Because they are not in a position to help themselves also. So suppose you'll be giving them some idea, something, they won't be able to take it. Rather, their abstract reasoning is disturbed. So even if you give them right ideas, they will take it in a wrong light.
Yes.
So the things will go in detail. So I just want to tell you in short, divide the neurosis or psychosis. Takes neurosis cases, don't take psychosis cases first of all. Then definitely when the app will be formed, will take you as a key caregiver in Calgary, and Roliji will be helping you, and we all will be having a team. So you sort out, and we'll be starting certain amount of courses also, certain small courses.
Definitely.
So you can go through that, and we'll help you. Don't worry.
Yeah, I'm doing whatever I can
society,
do.
That's wonderful. I'm sorry.
Yeah, your help will be really appreciated. Like I'm doing as much as I
do that,
can.
and we'll do that. Don't worry, because this is something which is the need of the time,
Yes.
and the mental illness has taken a toll upon everyone's health, and now a situation will come when government will also be getting bothered about these things, but that will take further 6 months to 1 year time when they will wake up,
Yes.
but damage will be done by that time.
Thank you so
Right.
much. Thank you.
Thank you
Roliji,
so much,
again,
Dr. Nilesh, for being here, and thank you all the participants for asking the right questions so that we can add value to others. And the vision and mission of Happiness Valley is to bring high quality products and sessions at lower, cheaper, affordable costs so that everybody can afford and take right doctors, right therapies, so that one
Very
can
good,
be
wonderful.
benefited. So,
Wonderful.
thank you so much. Thank you
Very
so much.
nice.
It was lovely having you all. Dr. Nilesh, please, whenever you have time, please send me a message.
Then
I
I'll
will
be
organize a
love to
session for
do all
you.
this, and Yes, surely, and I really congratulate you, Roliji, for a wonderful task. And I was thinking that it is group of health caregivers only, but since it's a mixed population, caregivers, mothers, and that's really amazing. So everyone is coming on the same platform, which is Happiness Valley.
Yes,
That's
because
really great.
it is the need of the hour to spread mental awareness, how to take healthcare, because every second home is having some sort of a problem. It could be a mood disorder, it could be a depression, it could be
Yes,
psychosis.
yes, yes.
I mean, it is very common these days, and we have to remove that taboo that going to a psychiatrist, normally people have that taboo
Yes.
that they will not go to a psychiatrist, they will go to a doctor, but they will not go to a psychiatrist. So we have to change this. When we have pain in stomach, we go and we take medicine. But if there's certain chemical imbalance in the brain, why are we hesitant in taking the medicine? So we need social
Yes.
approval also, so that people should understand that there is nothing wrong in going to a counselor or to a psychiatrist. And when one person in the family is dysfunctional, the whole family becomes dysfunctional. So if we are adding value to one patient, we are adding value to whole family. So whole family becomes happier.
True.
So with this message, I'm going to end the session. Thank you so much, everyone. Stay safe, stay
Okay.
blessed, take care.
Okay, bye-bye, and happy Republic Day first of all. And at the last, I would like to say that Roliji, kindly make a kind of, I think you guys have some group, but still, if someone is having some problem, so you can message me and really try to do it free of cost. Don't worry. Okay, but I
no
really want to
problem.
help whatever is possible from my side and from my hospital.
See,
Right,
I told you
Divya?
he has a beautiful, he has a heart of diamond. So, Divya, you have an
Any time, and Divya,
amazing
तुम therapist
opportunity
के-
now.